Hello, we are the last and awesome group. My name is Camila, Lauren, Nathalie, and we will be presenting on brain pacemaker for deep brain stimulation. So here's a little bit of an outline of what we're going to be talking about today. We want to discuss the history of the brain pacemaker, what the DBS is and how it works, the surgical procedure, and the certain risks and side effects that may come with it. So a little bit of a history of brain stimulation. People have been curious about the brain since, I don't know, in the BCs. There's been stories of like Leonardo da Vinci cutting out people's brains and like studying cadavers and whatnot, so scary stuff. But electrical stimulation actually began in the 1960s. They used this to distinguish different parts of the brain, and they discovered that stimulation of certain parts actually suppress symptoms of neurological disorders. So I don't know whose great idea was it to open up a brain and like start electrocuting certain parts, but I guess that's how they figured out that this occurs. And this is a cute little picture of how it was in the dark ages. And then Medtronic was actually the first company to actually come up with DBS, which is deep brain stimulation, and that was because long-term drug therapy caused more problems. They found out that it was actually making people more mentally unstable, and they were causing more neurological problems instead of actually curing it. So they introduced the first maker in the 1980s, and then in 1987, they actually did the first deep brain stimulation for movement disorders. But it wasn't until 2002 that the FDA actually approved of this. And since 1993, they have more than 80,000 patients were treated. So clinical applications of DBS is that it targets the thalamus, and this is the brain's message relay center for movement to suppress tremors. So it can possibly treat diseases such as Parkinson's disease, chronic pain, major depression, Tourette syndrome, and epilepsy.
So if you guys didn't already know, movement disorder is caused by overactivity in the brain. So, for example, if you're a normal person, a different person, trying to move your arm, and then because of overactivity, you might not be moving your arm, you're moving your limbs or something. So what the pacemaker does is it creates jolts of small electricity. It goes up from here to the wires into the electrodes in your brain that's implanted. And then what the electric pulse does is that it generates an inhibitor effect on your brain, and it inhibits the overactivity, so then you can function normal. Okay, so this is the mechanics of a pacemaker. It's a block diagram. It's a closed loop system. What it does is that it detects which part of your brain is having overactivity, and it sends electric pulses to that electrode only, because then more than one electrode can be placed. It could be 2 or 3. And depending on where the overactivity occurs, then the pulse is generated there. A pacemaker lasts about 3 to 5 years, or the battery lasts about 3 to 5 years. So then it needs to be replaced after that. And electrode placement is really important. There's 3 main places where it's placed. It's placed in the subthalamus nucleus right here, the thalamus, which is right here, and also the globus right here. Although these are the 3 main parts where it's placed, the actual location where it's placed, like the specifics, depends on the person, because everyone's brain works differently. So then what happens is that when they're placing the electrodes on the person during surgery, they will actually have the patient be awake for it, so that they can actually adjust it to the person's need, so they would be asked to move their arms or something.
Okay, so I'll be going through the surgical procedure of implanting a brain pacemaker. So the initial procedure is identical to a thalamotomy and a pallidotomy, which are incisions into the central source of the movement disorder. But instead, it places a DBS electrode on the target, and from the extensors, it's underneath the skin it passes through underneath the skin from the neck to the shoulder, and then it'll be implanted in the collarbone. And depending what the doctor wants, it could be either implanted that same day, or it could be implanted on a later date. However, after the patient is discharged the following day, the patient has to wait 1 to 2 weeks for the swelling to go down in order to activate the batteries. And then afterwards, the patient will have to go for multiple visits just to get the correct voltage regarding the magnitude of the electric impulses applied in their body. And so this is a DVS generator, which is a handheld device in which the patient can turn on they can turn on the function, the pacemaker, because going through security devices, at the airport, those magnetic fields can potentially turn off their brain.
Okay, so with the brain pacemaker also comes some complications, side effects, other risks, and whatnot. So some of the side effects are apathy, hallucinations, hypersexuality, et cetera, but with those risks, there are also some advantages that can overcome them. Like these side effects are actually maybe be only temporary, and you can actually reverse them through calibration and correction of placement of the pacemaker in your body. And then also, there's no using the brain pacemaker in your body doesn't damage any brain tissue. Also, stimulation from the pacemaker is also adjustable. So it's adjustable to be unique for each person's specific needs. And then another risk would be just during surgery, the possibility of your electrodes being dislocated or dislodged, which can cause personality changes or just complications of surgery like the bleeding of your brain, hemorrhages, stuff like that. And then after surgery, things like brain tissue swelling, mild disorientation, and sleepiness is actually normal. But after 2 to 4 weeks, the sutures are removed from the patient, and the pacemaker can be turned on, and then from there programmed to that patient's specific unique needs. And then there are also other treatments for deep brain stimulation other than using the pacemaker. And some of those are the surgical procedures, pallidotomy and thalamotomy, which Lauren had mentioned earlier. Pallidotomy is the surgical removal of a specific part of your brain called the globus pallidus. Dennis mentioned that earlier as well, which is located in the picture. The globus pallidus, when that part of your brain becomes overactive, it starts to decrease the activity of a different part of your brain that controls your movement. And so that this specific surgery can help you improve your motor dysfunctions like tremors and stuff like that. But pallidotomy isn't proved to last very long, unlike the brain pacemaker, which allows capabilities of readjustment and reprogramming. And then thalamotomy is the surgical removal of the part of your brain called the thalamus. And that thalamus controls involuntary movement, and that again helps to improve tremors, rigidness, like other motor dysfunctions. But the thalamotomy actually has no evidence to improve other symptoms for things like diseases like Parkinson's and epilepsy and the other motor diseases. And so, in conclusion, our brain pacemaker are used for deep brain stimulation to suppress symptoms for neurological and motor disorders. The electrical signals are passed to your brain through electrodes that are implanted in your brain through surgery using leads, extensors, and pacemaker. And the pacemaker is programmed to be adjustable without further surgery for different specific needs per patient.
What are you limited to doing? Like, are you limited in your activities that you can do after you have the surgery? Like, I would think if you got a concussion, like, it wouldn't be good. Are there limitations as to like what you can do in your life, or you can just live your everyday life?
After the surgery, of course, the first couple months will be hard to think of pacemaker affecting you. But then after those couple months, like especially with readjusting the voltages and the electric impulses, you should be leading a normal life.
Well, with like every surgery, like the doctors always just tell you to take it easy for a couple days. It's common sense that if it's a brain surgery, you're gonna be kind of in the hospital for a while.
Do you guys know how they calibrate each pacemaker to specific individuals?
They actually place the electrodes depending on the sickness of the person, and also the generator that Lauren talked about. You can actually change the amount of pulses that goes into the electrode.
Well, like during the surgery, like I said, the patient is awake. It's just the general anesthesia with the brain is when they're numb. But otherwise, they're awake during the surgery. So the nurses and the doctors will ask them like, "Oh, do this. Like, move your hand, say something," so they can target the specific regions of the brain in which they should put the electrode.
There's also like a controller that you can use to change or to adjust your pacemaker. So just in case your conditions also change for the patient, you can adjust or the stimulation from the pacemaker as well.
So there was a problem with these a while back where they kept causing orgasms to people. Did they fix that recently?
Yeah, no, one of the advantages or disadvantages.
Probably not.
I guess it depends on the person.
Last question.
What's the maximum voltage it can deliver? Because if it's not necessarily enough, what do you do?
I don't know the maximum, but like they can change it, like they can increase it or decrease it.
It depends on the patient.
Okay.